Good evening, everybody. We are thrilled that you're here. My name is Jim Derrick, and I am a co-founder and the director of family recovery here at the SAFE Coalition. And we're thrilled tonight to be bringing you a webinar on, I have to tell you, one of the subjects that is near and dear to my heart, especially now, and that, of course, is harm reduction. Before we get started on that, I just wanted to give you a quick overview of what SAFE is. SAFE Coalition is a nonprofit dedicated to providing resources, wraparound care, and help to people that suffer from substance use disorder or mental health challenges. We were founded back in 2016. We are here in Franklin, Massachusetts. We also have a location out in the Springfield area, and we're growing. All of our services, importantly, are free of charge to our clients. We are 100% donor and grant supported. So that's an important fact. There are four divisions of care that we have right now. We have an adolescent wellness or prevention division. We have a collaborative care division, which basically is anybody that needs help, come on in and we'll have one of our counselors engage with them and provide them with care and resources so that they can get on a path to recovery. I am the director of family recovery. We know that every time a family member is impacted by substance use disorder or mental health challenges, the entire family and indeed the family dynamic becomes disrupted, and families need their own care and their own recovery, and that's something that I provide. And then finally, I'm thrilled to say that October 1st of last year, we introduced our newest division, and that, of course, is that of harm reduction. And just on a personal note, I think harm reduction is a critically important piece of family recovery. Uh, One of the most essential things that someone can do if they have a loved one struggling with substance use disorder is to become educated and also to learn how to use language that invites people toward the table of recovery. But as they're doing that, are there methods and ways that we can help keep them safe? And that is where harm reduction lives. So I'm really excited about this evening. And with that, I want to introduce you to my friend and colleague and the director of harm reduction, Sarah Fleming. Welcome, Sarah.
Thank you, Jim. Thank you all for joining us, spending some of your Thursday night with us. We're excited to talk to you all about harm reduction. Before we get going, I just want to acknowledge the elephant in the room and just put it out there. This is a webinar, so you can see us, but we can't see you. We don't know who you are, but I am guessing there's a few talent agents who probably have signed on tonight, likely to scout us for hosting, I don't know, Amy, the Oscars, the Emmys, Saturday Night Live, like
The ESPYs,
yeah, your local Rotary Club event.
a
And
birthday party.
you don't have to reveal yourselves, but
Yeah.
we know, and we just want you to know we're ready, okay? Amy has created a beautiful PowerPoint, so just imagine what we could do with a stage and a musical score. Okay, so when this is over, and with that, we just want to clear the air. Now we're ready to talk about harm reduction.
Right.
Amy,
Here we go. All right. I'm just being a real tech whiz right now. Okay, here we go.
and I'll introduce my colleague who is amazing, Amy Young Sadler, who is our harm reduction coordinator and outreach coordinator, and made all of this tech. Okay, so our goal here tonight, other than to tell jokes, is to just talk to you a little bit about what harm reduction is and not just the practices, but the principles behind harm reduction, to talk about why we need to continue with this work, why it's so important, to throw some numbers and data on the effectiveness of harm reduction and bust some myths. And then we will have an opportunity for questions and answers, and an opportunity if people wish to, after the webinar, get some information on further resources and recommended reading if you are intrigued by what we've had to say. So first of all, what is harm reduction? Harm reduction is both a set of practical strategies, like actions that we do, and it's also a set of principles and ideas that are aimed at reducing the negative consequences associated with drug use. So we talk about like harm reduction, capital H, capital R, because it is a movement for social justice, and it's built in the belief that, and respect for the rights and autonomy of people who use drugs. It was born out of people who stood before us, the Black Panthers, the LGBTQIA community, are the people who and people who use drugs, obviously, who have brought harm reduction where it is. And because many nonprofits and public health organizations love acronyms, we just wanted to share a couple that you might hear us use or that you might not know. So you're welcome. I'm not going to read them to you. But one of the things that we want to just point out when we talk, that is a great way if you are wondering how you can start practicing harm reduction yourselves, is just by using person first language. So if you'll notice, we don't say, drug addict. We talk about people as people who use drugs because we're centering that they're a person before anything else. So making small changes to your language, we don't say clean or dirty because those have carry implications with them that suggest there's like a morality to using drugs when there's not. So those acronyms are there, but what is most important, I think, to center is the way that those acronyms center people first.
Exactly. Okay, so Sarah mentioned we're going to talk about some of the principles of harm reduction. The other incredible thing about harm reduction is that you can think about it like a framework to make decisions, to make choices, to make figure out how you can center a client or your family member and their needs. And the National Harm Reduction Coalition is an incredible organization, and they put together the 8 principles of harm reduction. So it accepts for better or worse that illicit and licit drug use is part of our world. I often say when we're interacting with other public health officials or other organizations, harm reduction lives in reality. So we can ignore things and we can repress things, but harm reduction asks us to acknowledge the truths in the world because you can't really help people progress if you are holding kind of a different idea of the world. So drug use exists. It's just a sentence with a period. We know it exists. We know that people experiment and use substances. We also understand that drug use is a complex, multifaceted phenomenon. If I'm using substances, there's a very good mathematical chance it's not the exact same reason that Sarah might be using substances. The reasons vary just the way that people vary. So we acknowledge that, and we understand that it's a spectrum of experiences. And I feel that this one is most important and very important when talking about family recovery, but harm reduction does not attempt to minimize or ignore the real and tragic harm and danger that can be associated with illicit drug use. Again, back to operating in reality. Harm reduction lives in reality. We know that there are systems, there are just things that are harmful, that are part and parcel with someone in your life using substances. And so it's important to just acknowledge that it's a component. And it affirms that people who use drugs themselves as the primary agents of reducing the harm of their drug use. And it seeks to empower people who use drugs to share information and support each other. We often explain it that it's like we're helping with, we don't like help at people. So yeah, all right. And so we'll move on to the next 4 principles. So it calls for non-judgmental, non-coercive provision of services. So we're not luring people in for services with the promise of something else. We are open and honest with our clients, and we we're not like trying to lure anyone into a treatment that they're not ready for. It establishes the quality of individual and community life and well-being. We don't have parameters for people when they come to us. So we're not saying that we're only going to help you if your goal is abstinence. We don't, like I said, the experience is a spectrum, and we're just in the middle helping people where they're at. And it is important that it recognizes the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other social inequalities affect both people's vulnerability and capacity for effectively dealing with drug harm. So I have a different capacity than a person who is unhoused. Much of their energy might be going to surviving. It's very difficult to maybe tackle some childhood trauma if none of your basic needs have been met. So, understanding that those external forces are just as important of an influence as, like, say someone's family. It ensures that people who use drugs and those with a history of drug use routinely have a real voice in the creation of programs and policies designed to serve them. There is a great mantra that really helps us remember. It is nothing about us without us. We don't write policies about the program. We don't look for new solutions without asking our clients. I have been lucky enough to not live as an unhoused person. So that means that I have to acknowledge that I don't have that experience. I can't make decisions based on that experience. So our clients are like, we don't have a harm reduction board of directors, but if we did, it would be our clients. Like, their experiences are the guiding force for how we back them up.
And I think, one of the most important things when you think about the principles of harm reduction is that it centers and uplifts the fact that people who use drugs are the experts on their own bodies, their own experiences, and their own needs. And the fact that someone uses drugs doesn't negate that. Just as we all deserve to have care that we talk about our needs and what we need, and that is heard and that is respected. Everyone deserves that. So everything we do is really just driven by what our clients want, need, ask for.
Sorry. In introducing the harm reduction as a concept, Sarah's going to talk more about the concrete ways that we deliver care, or other harm reduction programs deliver care.
So this is sort of an overview of harm reduction services. Every harm reduction program that you go to is different based on the needs of their community, where they are, the laws, everything. But this is just kind of a general overview of some of the things that you might see when you engage with a harm reduction program. So we distribute safe use supplies and have safe sharps disposal. So people are able to come and exchange, if they wish, things that they've already used and get, a full spectrum of clean supplies. Syringe exchange services keep people from contracting infectious diseases and needle-related injuries, which is why safe use supplies and distribution is central to our work. We provide access to naloxone and community education and training on that because that is a integral part of opioid overdose reversal. There are programs that will offer drug checking, which can be in the form of having test strips available or using a machine that can detect unwanted substances in a supply before someone uses it. The goal of drug checking is not to deter someone from using the drug. It's just to have them, everyone should be informed about what they're going to put in their body. So it's just about informing them and having conversations about their expectations and what supports can be offered. And we can offer connection to evidence-based voluntary drug treatment. That is not, I always tell people that we are a public health program. I never center us as part of a spectrum of recovery because that's not what we're thinking about when someone comes in and engages with us, unless that's what they center. But if that's what they center and that's what they ask for, we're there to support that. Um, we are we are fortunate enough. Our program has a clinician who is able to offer low barrier harm reduction focused counseling and mental health support. And then we try to provide, drug education, fact-based drug education, community education. And for our program currently, we are on a mobile model, so we do everything pounding the pavement and supply distribution, but we also help people with things like we call it short-term health navigation. So people need help connecting to health insurance, a primary care. They need to go to the dentist. They need housing. I mean, you name it. We do a lot of things we're probably not supposed to do, but we're going to do them anyway, because if we can, we will. And what we like to point out is harm reduction services are transactional if that's what the participant wants. So we can be out interacting with someone and someone can come up and give me, no, they don't even have to give me their real name and just ask me for the supplies and get what they need. And if that's all that they want, then that's what it will be. So again, the way that our services are delivered is completely guided by each individual participant and their needs.
And a kind of an intangible thing that our program and other harm reduction programs offer is a stability of non-judgment. So basically, folks can know that you can come in or see us on the street on a Tuesday, you can see us on the street on Thursday, whenever, and we are going to remain non-judgmental. Whatever occurs in your life that you're dealing with, you're going to come to us and you're going to have a non-judgmental experience. And for some folks, it might take like 1 second and then they're like on board. Other folks, it's 20, transactional transactions. And then eventually we've proved that we are a source of support. So it's kind of like I said, it's an intangible thing. It's just remaining a source of non-judgment. So it's important for us, Sarah mentioned it earlier, but it's important for us to, how did we get here? Who got us here? So harm reduction is born out of the mutual aid tradition. Like Sarah mentioned, things like the Black Panthers free breakfast programs. And the first syringe exchange programs were created by people who use drugs. We talk about legal syringe exchanges. 1984 in Amsterdam, they legalized syringe exchange. In Boston, we did not have our first legal syringe exchange until 1993. Up until that, it was illegal for you to distribute clean syringes of any kind to anyone before that. If you see the gentleman, the article that says 4 AIDS activists, he was a medical student from Yale who worked with ACT UP Boston. They opened an illegal syringe exchange called the Ivy League, which I can't help but love someone who's willing to not only risk their freedom to participate in syringe exchange, but is also has an excellent pun. But you'll see really people of color, people in the LGBTQ community, specifically Black trans women were some of the first needle exchange providers. And, even more recently, the opioid crisis had a deeply intense effect on Cape Cod. And we're so lucky in Massachusetts to have Kim Powers, who's an icon of harm reduction. And her quote here, she says, "If we didn't take care of each other, nobody was going to take care of us." So we started really trying to figure out the ways to advocate for ourselves and advocate for each other. Which again is that nothing about us without us. This is a community-based um, system of care. Uh, and that is so important because often when folks are deep in substance use, maybe in chaotic use, the first loss tends to be community. So if we can be a part of rebuilding that community, that goes so far. Um, and
And
oh yeah, go ahead.
I was just to say, some important things to just like point out here when we had talked earlier about person first language. Like these articles are older, so you can see some of the things that we're talking about. Referring like drug addicts, ex addicts. Um, this we have obviously made progress, but this stigma still exists. There has, of course, been progress with the laws and like legalization around what we do, but not everywhere. So just because we benefit from that, we are, part of a whole community of harm reductionists who do not have the same protections as us. And there is still so much work to be done. And just because there has been improvements in laws doesn't mean that ensures improvements in the behavior and the treatment towards harm reduction programs, people who use drugs. So while we always want to like center and honor the history and how far we've come, it's not done.
Um, so if we think about where we came and then like or where we came from, why are we here? Why harm reduction? So I think so there are millions of people across the world who fall somewhere between just say no and abstinence. There are people who just said, I guess, just said, yes, please, I no longer want to be in my brain. There are people, all of those experiences are valid. And without harm reduction, it's a pretty big gap. Um, harm reduction, the harm reduction model allows for flexibility and engagement. It promotes positive behavior, any kind of positive change instead of all or nothing. So we um, are big fans of a self high five and are often encouraging clients to self high five. You can congratulate yourself for anything if you lower the bar. And that means that, like, I can't tell you how many times a client has come in and I'm like, how you doing? And they're like, I'm alive. I'm like, boom, you did it.
Me too, baby.
Right. Like achieved blue ribbon on being alive this morning. Um, and like that is probably the best part of our job, being able to just remind people that the act of merely being in a world that does not want you to be is an act of like, success and revolution. So we are so lucky to be surrounded by our clients and to be able to support them through that. And we're also, I think I've said we're so lucky so many times, but in Massachusetts, we are so lucky because we also have people like Stephen Murray, the creator of the Safe Spot, which is an overdose prevention hotline. And I just love this quote. Harm reduction isn't about nudging people towards abstinence. It's about rejecting the idea that drug use makes someone disposable in the first place. I love
And if
recycling.
you're,
I love trash, and people are not disposable.
she does love trash. She's an artist. But if you're not familiar, just plug here. Safe Spot, not affiliated with Safe, but check it out. It is an overdose prevention hotline. So if you are someone who's using drugs and you are using them alone, you are able to engage with trained operators at Safe Spot who will stay on the phone with you and help come up with a safety plan so that you can use more safely. So we just always like to plug all of our friends in harm reduction who are doing incredible work.
Because I think Safe Spot is a credit to the flexibility of harm reduction. Stephen Murray knew we can't be with every single person in the state of Massachusetts using substances. So how can we be flexible? How can we create something that can meet people where they're at, which is not in our office? Okay, and I think you would struggle to find someone today who hasn't been affected by the opioid crisis, right? Like certainly no one on this Zoom is not affected by the opioid crisis. Like it has impacted all of us. So overdose prevention is obviously a huge part of why harm reduction programs exist. It's not the like we didn't start and end at naloxone, but certainly keeping people alive is our main goal. So 2024, we experienced a 36% decrease in opioid related overdose deaths, which is huge. For the first time, Massachusetts had under 1,000 opioid related overdose deaths. So that is huge. But it's not we don't really get to do the ceremonial back patting just yet. Because while those numbers have come down, it's not an equitable deduction. They have not come down for communities of color. Indigenous people still have the highest rate of overdose deaths. So while it's
Until they decrease for everyone, they have not decreased.
yes,
The work is not done, and we always like to center when we look at these numbers. These are numbers that come from reported overdoses, someone who has engaged with an agency. Many overdoses do not get reported for various reasons. So we always think it's important to center and lift up that we acknowledge that people who use drugs are actually the first responders to overdoses. They're just not calling anyone, but they are the people who are there. They're taking care of their community. They're just not often reflected in these numbers. So we always want to uplift that and acknowledge that they are really the ones doing this work.
yeah, we there's no way for us to quantify the incidents that I get, like Sarah said, have not been reported. And certainly it can be a slippery slope when we boil harm reduction down to numbers. But these are good numbers. So, and I think there is this, I have a great quote from Deidre Calvert, who is the director of the Bureau of Substance and Addiction Services in Massachusetts. And she said, it's important that nobody is a nobody and everybody is a somebody. When we look at those 978 dots, we need to remember that somebody loved each of those people. They each had a favorite ice cream, they each had a favorite pet, a favorite slice of pizza, and a favorite movie. These are human things, and every single one of those dots experiences those human things. So while it's wonderful that we decrease, like it's also fuel that we need to keep going. And it's also important to point out that unlike what the federal government has reported, these numbers are the reduction in these numbers is due to housing first programs, harm reduction programs, community naloxone distribution, putting naloxone in the hands of every person we interact with. These are the reasons why these numbers have come down. It does not have anything to do with criminality or arrests. It's really because of human first programming.
And this is like where I get all. This is my favorite part to talk about because while we've said that the work that we do can be just transactional if that's what the person wants, it's often not. It's centered on human connection, treating people with dignity and meeting them where they are without any judgment. And this is to me where all the gooey good stuff happens because it's really about community, mutual aid. When you call people into a community, all of these other things that we talk about, safety, education, housing, resources, legal aid, social capital, those all grow from the seeds of being part of a community. Like when we talk about social capital, I always talk about it as like the I know a guy effect, right? Like how many of us have ever been in like a jam and we know I know a mechanic who like helped me fix my brakes and he gave me like the effect of having community, someone who can like connect you to something, help you out, goes a long way. And so really for us, everything we do is just driven by trying to create whatever community is needed for our participants. We consider ourselves, just like members of that client-driven community. And when we create these spaces for people to feel safe and seen, and called by their names, when we see folks, we collectively, when people leave, we all say, "We love you," and not in like a weird way, but just everyone should hear that. Sometimes our folks, they haven't heard that in a long time, or someone hasn't hugged them. And I'm a big believer that I'm not sure how much has been accomplished by casting people out into the fringes of society and making them feel unwanted and unloved. So we are just, again, to say someone should be keeping a tally of how many times we say lucky, to just be a part of all the amazing things that happen, and to see people share successes with us that are their successes, what they deem as success. To me, if you had a toothache last week and you got to the dentist and you don't have a toothache anymore and you're like so psyched about that, I'm so psyched about that. And who am I to tell you you should be doing something different or you have to do something else before you can go to the dentist? Um, so it's really great for us to be able to connect people to other community resources. And it's important to mention that a big part of the services we try to connect people to is testing services, because again, harm reduction is part of public health. So we want to help people connect to get tested for HIV, Hep C, and whatever else they might need, and then get connected to treatment and care, if that's a next step.
And I'm sorry I didn't include this word on this slide, but I think the other thing that we, again, are so lucky that we get to connect people to is joy. Joy is available to all people. I feel like maybe has been some mixed messaging that if you are a person struggling with something, you're not allowed to experience joy. We bring joy wherever we can, whenever we can, because it's a human right. Our clients deserve to have the lightness and freedom that experiencing joy can bring. So whether it's like stickers or a bubble machine, like whatever random things we can find that we can bring an energy of joy to our clients. It has been life-changing for me. And I think it's like, again, we're just trying to increase the quality of life however we can.
Sometimes like a frequent comment that we get that is well intentioned is people will say, you're doing like God's work, and we say, no, thank you, there's an implication like our work it is challenge. It's not easy every day, but that the population, the people that we work with are they must be so hard to, and I'm like, I'm having a great time most of the time. Like we're laughing, there is joy, there is warmth, there is laughter, hugs, all of these things. And so usually the God's work that I'm doing is when I have to like, argue with funders and legislators of why we need to continue this work. But it's never in the work that we get to do each day.
Absolutely. So probably tied with lucky for the most repeated word of the evening, is the word evidence. There's so much evidence. It's the best. I don't have to have any questions about whether or not I'm acting, whether I'm working appropriately, or that our program has a right like to exist, because there's 30 years of documented, peer-reviewed scientific evidence. I used to carry around a binder. It got too big. It's a bookshelf now. Like, I could find you articles for any component of harm reduction. There's so much evidence. We have learned that evidence is important, obviously. That's how we build everything. It doesn't go as far in terms of like convincing people why they should get on the harm reduction train, because sometimes it's a long article about the recidivism rates of Hep C treatment. But like it's amazing that it's there. The joy and all the other stuff is like we don't have as much documentation about it's how important it is, but we have proof. We um but yeah, like the non or the intangible stuff is really where we find that, you know, the quote unquote magic happens. So it's even better to know that we can like make magic with the backing of science. Um, so yeah, I mean, safe syringe programs, they improve access to healthcare services. Every time someone walks through, well, we don't have a door right now, but every time someone walks through our metaphorical door, they're closer to staying alive. That's it. They're closer to being connected with other services that they need. Um, SSPs are widely recognized for their role in reducing the transmission of bloodborne pathogens. In our area that we work, previous to there being a syringe exchange program there, they had one of the highest Hep C rates in the state. Since then, the Hep C rate has come down drastically. The opioid crisis completely derailed. The World Health Organization had plans to lower Hep C numbers by 30% across like the globe. The opioid crisis again derailed that. So we're really trying to kind of play catch up with Hep C, keep people healthy, and all of that improves the lives and the quality of health of the entire community. When we keep people out of the emergency room, when we keep people well, it improves the experience for everyone. So yeah, community-based naloxone programs have successfully equipped individuals at high risk, and I think this is, you know, another great part, as well as their friends and family members and their aunts and their grandmas and the lady who works at Shaw's and whoever else. Again, we can put it in their hands. It's also an opening for conversation because if I'm going to give you naloxone, I'm going to also, you know, talk to you about how to use it. And it's just another conversation that lives in reality where we can humanize people and talk about, you know, if you have the chance to save someone's life, why wouldn't we take it? And again, just to mention 30 years of research, they're safe, effective, and if you are a legislator in the or a town manager of some kind, they're cost saving. Like, so we're magic. Harm reduction is magic that is backed by science that will save you money and keeps people alive. So,
Wow, I'm in. This sounds great.
right.
Right. And again,
I'm
yeah,
really
we're just
selling
entering.
us to our own program, but
It is like a rising tide lifts all ships. It's good for me when my neighbors are healthy, regardless of what that is. Like it's good. Washing our hands is good. So like this is along that spectrum of public health. And again, we always center that we are very lucky that there is data to back up what we do. And I always say like this is part of my belief system, is what I believe. And I'm also fortunate to be able to say science makes my beliefs backed up. But even without all of that, the most important piece of data that we ever get is just from our participants. They're telling me that what I'm doing, what we're doing, what we're all doing together is making their lives better, their day better, their day easier. They feel healthier. Then I'm going to continue to show up to work every day.
yeah, we would love to put ourselves out of business, right?
The next slide is a quick video clip. We were really fortunate to go to the Drug Policy Alliance conference this year in Detroit, and see incredible speakers, and just it was life-changing. So we just included a brief clip from that we thought we'd share with all of you.
Didn't know about harm reduction when my son was alive, but I do recall the first time we practiced it. He was in a motel and he wouldn't admit that he was using, so he wouldn't take naloxone. My daughter and I sat outside the hotel room in the car, and he had to text me every few minutes because we would be ready to be down the door and use naloxone if necessary. That's harm reduction. Nobody wants to accept that their child might be injecting drugs. Not allowing them to have access to what they need is not going to stop them. If your child came to you and said, I'm going to do this, would you want them to reuse a syringe and risk getting endocarditis or HIV or hepatitis C? Or would you want them to use a clean syringe? We need to keep them safe, regardless of how we feel. We need to remove our expectations and judgments from the equation because that's what's killing people. Stigma, expectations, assumptions, judgments, those are dangerous. You need to love people where they are. Harm reduction is unconditional love. We practice harm reduction without knowing it, and we need access to the tools for everyone to be able to do this.
That's the one slide we're not going to comment and talk on because we couldn't possibly say more to that, and we've talked a lot. So
that video also felt particularly important because probably within 5 minutes of meeting Jim, the first thing we said was like, you've been doing harm reduction, you just didn't know it. You just didn't have like a label for it. So I think there are so many people, especially so many parents, who will realize like, oh, something I was doing was harm reduction, and I either didn't, I couldn't acknowledge it or I didn't know. So I think that's just like such a special experience. Okay, so now we're going to play a high stakes game of Mythbusters. And I'm going to share with you some of my favorite myths. Harm reduction services enable drug use. A safe syringe program will increase the number of littered syringes. Harm reduction programs increase crime. And harm reduction is only for people who use drugs. So unfortunately, this was a prank, and these are all myths. So again, we've talked about like the 30 years of evidence. There's evidence for all of these things. Colloquially, I have had someone say, I've never not done drugs because you guys weren't open. When folks are in pursuit of potentially risky behavior, they aren't more likely to do something if they have the safer supplies. And also, I've never had a client walk in and say, hello, madam, I'm interested in drugs. Might I have the supplies? That typically someone's first step in the spectrum of substance use is not to the needle exchange. And a safe syringe program will increase the number of littered syringes. No, it will increase the number of harm reduction workers in your area picking up syringes, or there will be more access to safe syringe disposal. And harm reduction programs increase crime. Nope. Actually, with the syringe litter, they studied a safe syringe program across a year, and it actually had 85% less syringes than other areas. And yes, there's no evidence that harm reduction programs increase crime. If anything, it goes in the other direction. And harm reduction is not just for people who use drugs. Harm reduction is for everyone, both to like receive and practice. In light of what we just recently said, a lot of us are practicing harm reduction in a variety of ways all the time. It's just not called that. So if you're wearing sunscreen or a bike helmet or a seatbelt, you're reducing the potential harm to those activities. So yeah, harm reduction is for everyone. And I think that is it. And then I think AJ will let us know if we have any questions.
Yes, and you can go ahead and stop sharing.
Oh, wonderful.
Adjusting our videos at the same time.
Thank you.
Lost Jim. Come back, Jim. All right. I'm AJ McCormick, Executive Assistant at SAFE, and I'll be moderating the Q&A. You can use the little Q&A button at the bottom of your Zoom to share questions, or you can send them to the chat through us. The Q&A, you do have an option to share questions anonymously if you would like to remain anonymous. And I'll go ahead and get started with one I provided while everyone's typing up their wonderful questions. So Amy and Sarah are such an inspiration, like to our office, to we have our staff does like ride-alongs with them out in the safe van to go out to the area they do their work and just come back like, this is my thing, I want to do this now. So I think tonight you probably inspired a lot of folks. What could you say to them as like first steps to get involved, like even if they're just like what I while y'all were talking I was thinking of as like micro activism, like something where they can make these first steps towards being part of the harm reduction work?
I think first and foremost, it just starts in your community conversations. Talk to your neighbors, talk to your friends, talk to your loved ones about harm reduction. It is as small as starting with how we talk to people, how we talk about people. Get your hands on some naloxone. It should be free. It is not. We are again lucky in Massachusetts that is accessible, but we often tell people like it should just be part of your first aid kit. Leave it on the bus if you want. You never know when it can't hurt to have it. If you want to get more involved, it it should not go as a surprise that many harm reduction programs are, you know, understaffed and have a lot of participants. And go find a volunteer night. Go off. A lot of harm reduction programs offer those, or you can go and help. Many hands make light work. And reach out. And then I guess the final thing I would say is involve yourself in mutual aid. Harm reduction is about mutual aid, helping your neighbor, you know, before you're going to throw something in the trash, where Amy will probably go dig it out. See if someone else wants it. You know, it's all about helping each other, and it's easy to get involved in mutual aid. And then hopefully if we share out some resources after this, a great way is to read and support and shout out those resources, share them on your social media, donate to those causes. A lot of harm reduction programs are grassroots. They're out there doing their thing with sometimes their own money. So all of those things are great ways. The great thing about harm reduction is that there's not, it's not gate kept. Like you have to have these like credentials and do these things. Is like you don't.
The only way to do it wrong is if you're increasing the harm.
Yeah.
You just point the arrow down and you're in.
If I could just add a couple of things,
Yeah.
guys, I just one thing is that every Friday from 8:30 to noon here at SAFE, 31 Hayward Street in Franklin, we have open hours, so no appointment necessary. If you want to come in and talk harm reduction, we'd love to have you to have a conversation. Secondly, I'd encourage people to talk to their legislators, both on a state as well as a very local level, your town select people, town council. Talk to them about this. It's a very active issue in the legislature. It has been for quite a while. There's a ton of stigma, nobody's fault, just it is what it is, but education is the cornerstone to that, and hearing from the community does move legislators. So please do that.
You can order
Absolutely.
some cool t-shirts. We're not wearing them, but if you want to show that there's plenty of cool
We'll
merch.
include some t-shirt links in the
Yeah.
resources. I
That's
think
when
like
you really made it.
if you think you know, we all have spheres of influence, right? Like we can influence directly, broadly. Some of us have more influence than others. But if you think about starting in your closest sphere of influence, listen to language. And like we talked about first, you know, I don't expect people to leave this webinar and be like, it's people who use drugs. You know, you'll get there. But challenge someone if they use the word crackhead. Just be like, find a different insult. Find it, you know what? Crackhead, dirty, clean, any of that stuff. Once you start listening for it, it's everywhere. And it's just like, you know, a death by 1,000 paper cuts. you are not like it doesn't hurt someone maybe to hear it one time, but to hear it colloquially like across everything, like that's difficult. Like your part of your identity is a joke and a put down. So anytime you can kind of like with your people who are close to you who won't, you can kind of redirect someone versus like telling them they're doing it wrong. But that those kind of like little changes, they get you there. And I will tell you, as a person, my first day of my internship, I repeatedly whispered the word crack because I hadn't talked about crack a lot. And I would be like, "Do you want to pipe?" And finally, someone was like, "You have to stop whispering crack." I don't know why. It just, wasn't something I came to my internship talking a ton about. So, you don't have to know everything. You just have to show up like a person who cares.
Sarah,
And a final plug, sorry, I know there's more, but if you are in a community where you see an improperly disposed syringe, connect with the harm reduction program. We give out free sharps containers. You can dispose of them yourself. They do not move on their own. And as long as you don't touch the sharp part, there is a safe. That's a great way to contribute to harm reduction, is just decentering the conversation around that syringe is there because of a person who uses drugs. And it's just litter that we should all be like helping to clean up. And there's a safe way to do it. And everyone can do it.
and you both taught me last week that even like just household trash that you might be throwing away, a plastic tub of some kind, that could be a sharp disposal if you can't access safe disposal some way. Sarah, you mentioned naloxone. In case that's new for anyone here, could you explain what it is, who should carry it, and where someone could access it?
Sure. Naloxone is some people might know it as Narcan. That's the brand name. But we try not to use that because it can be other things. There's also Revive on the market, which is a lower amount of naloxone, but it is used to reverse an opioid overdose. You can get training. You can be trained on how to use it. It is simple to use. Even if you were not trained and you had some, there are instructions. You can get it, you can purchase it at the pharmacy. Please do not reach out to us. We will help you find some for free. And who should carry it is literally everyone. I have it in every area that I could possibly have it, every bag, because why not? It is important to also mention that one of the things we focus on in addition to naloxone education is compassionate overdose response, and teaching people to know if they might be responding to an overdose, that sometimes we don't always have to use naloxone to revive someone, and kind of how to determine that and the reasons why that might be the case.
So, question from an attendee. In terms of harm reduction, how can that be worked on things such as vapes? We're seeing it increasingly worse in the youth, and how does this strategy work with things like vapes?
So, I mean, working at SAFE made me aware of like vapes with young people. Our clientele are not like high school students, so I've been a little bit out of the loop. Even though I'm so young, I just out of high school, but that is a deeply that's a tough issue. I think with teenagers, they will respond well to the fact that harm reduction lives in reality. So they're experiencing, it might be like worth some investigating what the factors are. I imagine very like social. But I feel like it's an opportunity where you can say, I absolutely do not know what to do. How can I lessen the harm? So if a teen is like, stealing and like maybe, I don't know, like accessing illegal vapes or something, like You have to kind of navigate and find the area where you can lessen the harm. Even if it's just like talking about it. Uh, but on like,
And
yeah.
it's a tough question. I mean, also having conversations with the person you know who vapes, because vapes can also be a form of harm reduction. It might be that they are vaping in lieu of a different thing, and perhaps you did not know that. And so it can sometimes help to still look at it as part of the spectrum of practicing harm reduction, while acknowledging that it has harmful effects on your body.
So this is our family recovery webinar series. So I want to make sure we have a chance to talk about the family component as well. So if someone I love is using substances, how do I support them even if I don't agree what they're doing? And how do I maintain those boundaries? And we might get Jim in as well, who is our director of family recovery, to give some insight there.
Well, thank you. Yeah, I might start that off first of all by saying this is like the number one question that we get. It's the number one question I had with my own lived experience with my son, and it's the most challenging to navigate. So I might as well just call it what it is. There's no expert that could give you one direct answer. But I do want to say that the principles of harm reduction are something that I wish that I'd had years ago when I was working with my son. Our expectations as family members, because we're so frightened about what may happen, justifiably so, is usually to go right to the abstinence-based model and say, my son, daughter, uncle, aunt, loved one is not going to be acceptable to me. Their recovery isn't acceptable to me unless they're abstinence based. Okay. And that's a very challenging place to be, because the reality, as Sarah and Amy have just shown us over the last 45 minutes, is that that's not where our loved ones are living. They're not in that space yet. So, how can we promote safety as this goes along? And that is a conversation. That video was excellent. How can I keep my expectations, to put it another way, from killing my loved one? And that may sound harsh, but that's how I felt as I was looking at my son. My expectations were not aligning with reality. And so, how can we do that? And so the answer is that I think it's part of the conversation that goes around with wraparound family recovery and with wraparound care for your loved one. Can we get somebody comfortable with the notion, both in the family side, that they can support somebody who's using in a less harmful way? So maybe instead of fentanyl, they've downgraded what they're using. In my son's case, he wanted to smoke marijuana. And I wasn't supportive of that years ago in any way, shape, or form. My language wasn't supportive. It was obvious to him that I wasn't supportive. So he continued to reach for what his substance of choice was, which was a more dangerous drug. So I think it's a tricky conversation, but it's one we navigate here daily. So I'd encourage you to come down. I did want to make two other quick comments. One is that we are Narcan, we do have free Narcan here, and we will come to you. So if you want Narcan, please call us, and we'll be more than happy to get it to you. And then somebody asked a question about Kratom 7-OH, very, very dangerous substance. I won't do a deep dive on it right now here, but you certainly can contact us. We have a lot of white papers on it. It is a part of the Kratom family. And what I would encourage you to do, in Franklin, we just eliminated sale of Kratom from all smoke shops, gas stations, and many communities are doing that. So I would encourage you once again to get out in front of that dangerous substance and try to get it off the street.
We also always think it's important to advocate that, one of the best things you can do to keep people safe is not always about stopping the supply of something, but ensuring that the supply of something is safe. That's why we're fortunate to be working on work with great community partners who help us with test strips and drug checking, because sometimes a stable supply that has been tested and we understand what is in it is what keeps people safe. And just to jump back to the question about setting boundaries and how we have these conversations with our loved ones, I think the best thing you can do is just be your authentic self, and it's okay to say, I don't really agree with or understand what you're doing, but I want you to be safe and I love you and I would like to understand more. And when we set boundaries, boundaries are for ourselves. So I think it's always just a good checkpoint to ask, like, if you're setting a boundary, if you set a boundary, the other person sometimes doesn't even need to know about it because it's not meant to try to get someone else to do something that you want them to do. It's for what you need. So I think sometimes we have to check in with ourselves if the boundary that we're setting is because of a safety or because we feel a little bit unsure, uncomfortable with what's happening. And that's a hard.
Yeah, again, like Jim said, like we've said, this is a protocol or like a framework built in reality. So at no point are there magic words you can say. I find comfort in, boundaries are the framework with which I can continue loving you. So these are the ways that I can keep, that we can stay connected. A deeply simplified like thing that I have said to people to kind of communicate. So substances might be filling a role. People use them because they work. So if they're working, that means that to remove them from their lives, they may need a replacement like habit. They may need to learn new habits. They need new ways of being in the world. When I learned to ride a bike, my dad didn't stand on like a balcony with like a megaphone saying like, "Hey, loser, not riding a bike. Why don't you start riding a bike?" Like he may have wanted to, but he, was encouraging because I was learning a new thing that I had not done before. So I think while he also wasn't telling me like, "You're doing amazing," as I was like laying on the sidewalk, he came over and, picked me up and put me back on the bike. It it's not we can't have expectations for people that are outside of like human ability. Typically people are not motivated by shame. I am not. So if we can at least keep that core of reality and support, I think it goes a long way. And then, come to safe and Jim can help you get the rest of the way.
All right, so we are at time, so we'll wrap up. But before I hand it over to Jim to close up, could you just let us know if someone takes one thing away from today's presentation, what would you like that to be?
Just how funny and wonderful we end up. That harm reduction is for everybody. It is just about loving your community. We all belong to each other. But as much as that is gooey and great, the work is not done. The fight is not over. It is not over until every harm reduction program and every person who uses drugs is safe and protected and their voice is heard. So we can't rest now. This is not the time to do this and stop. This is just the beginning. And we're not going anywhere. So
Thank you guys so much. What a
thank
great
you.
presentation. Thank you for everybody that came and participated. Thanks for those that shared. Congratulations on recovery. We love and support recovery. And that's the other thing, the other part of the myth that I thought harm reduction was the opposite of recovery. I didn't get it. And so, like everything, our understanding continues to evolve, and it's up to us to lean in and evolve with our new understandings. And I will tell you that harm reduction it has been the most impactful division of care that we have added here to SAFE in recent memory. It is critical work. I couldn't be prouder than to work with the team led by Sarah and Amy. It's just a joy every day and truly represents the unconditional love that we love to get ourselves and that we can now share with those that were previously marginalized. And I'm just so proud and happy to be supportive of you as you lead this effort through SAFE. So thank you all
Yes,
very much. Please remember
Don't give
that
it to me at the end, Jim.
we love crying. We love crying. That's part of our harm reduction, right?
Yeah,
Um,
cry.
Yeah, so we just want to encourage you. Please reach out to us. AJ is giving you all of our web information, emails. We encourage those. And most especially, come on in for a hot cup of coffee, particularly on Friday mornings between 8:30 and noon. We would love to see you. It's a fun group. And with that, AJ, thanks for everything. We will see you. Oh, please join our next webinar. And if you're not on our mailing list, please join that mailing list so that you get notifications. Every webinar will be the last Thursday of the month. Thanks again.
All right. Thank you, everyone. Well
Thank
done,
you.
Amy and Sarah.
Thank you. Thanks, AJ.